Welcome back to Daytime, everyone. We hear so much about breast cancer in women, but we can't ignore the fact that men are affected by this disease as well.
In women, the incidence is 1 in 8. In men, it's 1 in 1,000. Dr. Carmela Sebastian joins us now to tell us more about breast cancer in men. Great to have you here.
Thank you. Nice to be here.
So are the symptoms the same for men as they are in women?
The symptoms are the same, and what you'll be looking for is a lump or a mass in the breast tissue. In some cases, just as in women, the skin over the breast is affected, so you can see a little bit of a dimpling or what we call orange peel. And in addition to that, the nipple can be affected in men, where it could be red or it could be scaling. In some cases, the nipple will turn in, or you can have a nipple discharge.
Okay, so what kind of breast cancer is actually in men?
The most common form of breast cancer in men is the same as what is the most common form in women. There's a lot of similarities between the two, and that's ductal carcinoma.
Okay.
So it's a particular part of the breast that's the ducts, and it gets a cancer with it, a carcinoma, and that is the most, that's 9 out of 10. Lobular carcinoma, which is another kind, is much less frequent, and then there also is a disease called Paget's disease, which is breast cancer in the nipple area, and that's very infrequent.
Okay.
Do we know what causes breast cancer in men?
Well, it's just like in women. We really do not know. There's a lot of ongoing studies, very fascinating ongoing studies in men. However, you know, we know there are some risk factors out there that will increase your chances of having breast cancer, and I think that's what's really important to know those. Now, the one that we can't do very much about is genetics.
Right.
So we can't pick our family history.
Right.
Family history is definitely a risk factor.
Now, what if your mother had breast cancer?
Yes.
Does
Yes.
that put men at risk?
It sure does.
Okay.
It sure does. Because think about the incidence of it. Female breast cancer is 100 times more common than male breast cancer. So we would almost never see breast cancer if it was a male passing it to a male. So
Right.
it is female. Any female in your first-degree females that had breast cancer would be a risk factor. In addition to this, we know that there is a gene mutation on the BRCA2 gene, which a lot of people have heard of. It's been mentioned in other cancers, ovarian, etc. And when you get a mutation on that gene, you have a higher risk of getting breast cancer in men as well as women. And another thing that I think is really important, because it affects how you're going to live your life truly, and it is actually something that you can modulate, is the estrogen in the body. So, you know, men have male hormones, androgens, and females have estrogen. When a man is in a position that things happen, that he has a lot of estrogen circulating, either you're more apt to get breast cancer or your breast cancer can be more aggressive and grow. So, you know, what increases your estrogen? Well, first of all, a heavy body status. So fat in the body actually takes male hormones and turns them into estrogen.
Especially in the torso region.
The torso region, very, very important. So that's one of them. The other thing is your liver. Your liver is very responsible for our hormone balance. We don't really think of that too often.
No, we think of other things.
Yes, yes. So if you have cirrhosis or liver disease, you will have a higher degree of estrogen in the body.
Does it affect men at a particular age, or, you know, are there higher occurrences at a certain age group?
That's an interesting fact. It's different than it is in women, because, you know, we've seen cancers in women as young as in their 20s. In men, it's really in the 6th and 7th decades of life.
Okay. And really quickly, are the treatments the same as women get?
The treatments will be very similar, but of course, you know, it's very difficult for men to go through some of this. So, for example, mastectomy is very commonly done.
Right.
The other thing is 9 out of 10 breast cancers in males are estrogen receptor positive, which means that they grow with the estrogen in the body like we talked about. But there are drugs like tamoxifen, which block the receptors, and so that's usually used.
All right, Dr. Carmela Sebastian, thank you very much. Really interesting.
Thank you for having me.
Good information. We will be right back with more Daytime, so stay with us.